Hello, everyone. I'm the director for Common Knowledge Trust, and we're a registered not-for-profit in New Zealand, and we're a registered educational charitable trust. We promote a concept around childbirth, which is that it's normal and natural when you're pregnant to self-learn birth and birth coaching skills, and then use those skills to work through the activity of birthing your baby, no matter where you birth, no matter who's present, no matter your beliefs, no matter your circumstances, no matter your choices or lack of choices or change of choices, and no matter what happens to or around you at your birth. For 50 years, we have promoted this concept, and for 50 years, families have used the birth and birth coaching skills that are housed within our charitable trust, Common Knowledge, known as Birthing Better. However, because I'm posting on Breech Facebook networks, my goal is not about selling our product. My goal as the director of a trust is to promote the concept. And to promote the concept, I need to talk to you about what is happening in the Breech movement at this time, and in some ways compared to what was happening when I gave birth in 1970 and when I gave birth in 1982, and what I've lived through and what I've seen change. So today I want to talk about what exactly is breech pregnancy, breech babies, breech birth. What are they? Because they are wrapped up in three very intense words. And those words, the meaning of these words have changed in my lifetime. And that's what I want to help you understand, so you can make sense of these in terms of your breech baby. So what are these three words? Normal, natural, and physiological. But what do these words mean? And what do they imply to us who have breech babies? So one is you need to look each of them up in the dictionary definition, because you will actually be surprised. Because we have, within any language, we have a dictionary definition, and then we have common usage, we have innuendos, implications, denotations, philosophical perspectives, and all of those things are influencing us at the present time. And this is what I want to go through today with you. So you need to look up the word normal, not the word normal birth, just the word normal. Don't look up natural birth, just look up natural. Don't look up physiological birth, just look up physiological and find out what they mean. Okay. And then we need to begin to ask questions. How are these definitions applied? Right? What do they imply, and how are they applied? So for example, how do our diverse maternity systems approach these diverse definitions? For the medical profession, the word normal basically means really anything other than a cesarean, and that it is what it is. The medical profession has always, in some ways, treated these words more in the same way that people where there's no medical care treated. So it's treated as normal, natural, and physiological, which means that anything that might happen could happen. So, and they treat, the modern diverse maternity systems treat normal as a potential that may have a risk. They believe risks are natural and normal and physiological, and they believe that risks can become problems, and that problems can become tragedies. But modern maternity systems know that there are multiple risks. There's no general risk if you're you're not having a breech baby, you don't have the risks associated to breech baby. But in fact, both of the risks, an entrapped head and a prolapsed cord, can happen with a head down baby. So you need to understand that the modern medical profession treats risks as though they should be monitored and assessed, and if necessary, procedures should be applied. When I gave birth in 1970, 95% of us labored and had a vaginal birth, and that included most risks because the modern maternity system wasn't sophisticated enough. And modern women in the 70s were not as risk averse as they are now. And so consumers actually led the change. And we see that reflected on the Breech Facebook pages now. People are having lots of ultrasounds. They're trying lots of things to turn their breech babies. They're very involved in trying to reduce the risk rather than accepting the risk and trying to reduce or prevent the risk from becoming a problem or the problem from becoming a tragedy. So we know that the medical profession does lots of assessments, monitoring, and procedures. And most of us who live in the modern world feel grateful that that exists. So when I gave birth in 1970, most breech babies or twins or multiples and all the other risks were basically we labored and had a vaginal birth, whether we had a tragedy or a good outcome, whether we labored for hours or days, whether we coped or whether we suffered, whether we liked birth or whether we were traumatized forever, whether our body healed well or our body was damaged. It was just, there wasn't any choices about, period. There weren't any choices, but the medical profession didn't have the ability to actually give us those choices. And when choices became available, basically the natural birth movement then implied that choices should be to say no to medical care, the medical assessments, monitoring procedures, which were now called interventions. So we now know a little bit from my viewpoint of how the modern diverse maternity systems have dealt with the words normal, natural, and physiological. And so the natural birth movement, which really grew in its prominence in the late 70s and the 80s, between my two births, was the words normal, natural, and physiological really became known as something other. Those words began to imply that that birth was safe, that birth was easy, that birth was manageable, that risks were normal and would have a good outcome, and that all you had to do was trust birth. That's been the message since the 80s. Women just need to trust birth. That women have always given birth. Cows and cats aren't taught to birth. That we just need to birth outside of the medical profession or say no to medical interventions. And we need to be left alone to discover birth by ourselves, and that our care providers should give us the birth that we want, and that we know what we want, and we can write a birth plan to articulate that, and that birth is just something that has a good outcome, and it's natural, and it's just normal, and it's physiological, and so it should be hands off, and she'll be right, that it's really a nothing burger, right? And that's really the conflict between the modern maternity system and the natural birth movement is really, in my experience, is that the modern medical system believes that a birth is safe after the birth is completed, whereas the natural birth movement believes that a birth is safe unless something comes up. But unless something comes up has a huge implication, because the words normal, natural, and physiological actually do mean that anything that might happen could happen. And when you are faced with a problem, if you haven't done something to try to prevent that problem or reduce that problem, then that problem can become a bigger issue. And that's what we want to talk about today. So those of you that are now pregnant with breech babies are pulled between the dictionary meanings of these words, their implications, the innuendos, the common usage, the medical identification of it, the natural birth conversations, how women are talking to each other, the choices you have, whether you lack choices, whether your choices change, and our fears. So we want to address those things today. So the other question we begin to ask ourselves is, what are the causes that predispose my baby to lie in any of the breech or transverse positions? Because what I'm seeing in following Facebook breech groups is that that's really not a conversation, nor is the conversation about what normal, natural, physiological means, nor is the conversation about birth skills, right? So there are reasons why our babies are head up or transverse. First of all, it's normal. No matter how your baby is inside you, that's normal and it's natural and it's physiological. But it has implications to what happens at the birth, right? Risks are normal, they're natural, they're physiological. Whether we can reduce or prevent risks is something nobody has been talking about in the 50 years I've been involved in birth. But in the 40 years, well, in the 50 years that I started to develop skills with hundreds and hundreds of families, we began to address that issue back then. Because in 1970, when I gave birth, we were attending the first childbirth preparation classes, which was all skills-based, Lamaze and Bradley, which weren't great skills because it was the beginning movement of a skills-based concept. But those skills were dismissed because they didn't produce this ideal, natural, normal, physiological birth for enough people. So the natural birth movement then said, skills don't work, birth is natural anyway, so we just need choices. Women just need to say no to medical care. But they missed a lot of things, which I'm not going to get into now. You go to our YouTube channel on Birthing Better 1, then you will have lots of videos about my explaining this. So why are our babies predisposed to being in a breech position? One is, one is some of us have a septum in the uterus. And a septum in the uterus is just that there's some piece of soft tissue that flattens the top of the uterus. It can either be right in the middle or it can be to the side. And how do we know this for our own body? Well, most uteruses, the ones that don't have a septum in them, once they get to 24 weeks and more, particularly at 28, 30, 32 weeks, the top of the uterus is very rounded. It's very rounded. It has a symmetrical roundness to it. That uterus does not have a septum in it. Right? If the uterus is flat, sometimes it's actually quite heart-shaped. But if it's flat, or if it's not symmetrically round, if it's sort of off to one side round, the chances are there is a septum in the uterus. That's normal. That's natural. That's physiological. And the baby fills up the space appropriately. Also, where our placenta lies is a factor. And of course, if we're having twins or multiples, that's a whole nother conversation. So the other really two important factors is how toned is our uterus. For us who have multiple children, our uterus is like a balloon. You start off with a balloon that's quite tight. It's quite hard to blow up. You have one baby, the balloon deflates. It's a little bit saggier. You have 3 kids, 5 kids, 10 kids. That balloon gets flabbier, right? That's the uterus. That's the uterine muscle. So the uterus, if it has toned muscles, hold the baby close into our body. And if the uterine tone is not good, then the uterus gets flabby and can sag above the top of the pelvic floor. The cervix is below the top of the pelvic floor, but the neck of the cervix goes through the pelvic floor, and the uterus, it grows on our inside of the pelvic floor. And if our uterine muscles aren't toned, the uterus can sag to one side or the other, but that's constrained by bones and ribs, so it sags forward over the pubic bone, which means that our baby has more space inside and then just gets comfortable. And those are the breech babies that turn a lot. They'll turn a lot. Whereas if you have a septum, your baby tends to stay in one position a lot. If you have a weak uterine tone, the babies can constantly be flipping around, or the baby is quite small relative to the space inside. The other thing is our belly tone. So if we have weak abdominal muscles and combined with weak uterine muscles, then those two things just sag forward, and the uterus is what gives the baby space. But having weak abdominal muscles, the baby doesn't come into the inlet of the pelvis very well. And there may be other factors that I haven't mentioned, but those are the most common, right? Even for transverse babies, right? The most common reason really is weak abdominal tone or a septum in the uterus, right? So if anybody else has any things, just speak up. I'm not the be-all and end-all. I just got taught by hundreds and hundreds of families, and we figured out what was going on in our body, because honestly, I don't care what's going on in your body, and you don't care what's going on in my body. If I have a septum in my uterus and you have a weak abdominal tone or weak uterine tone, we're dealing with different things, right? The risks may still be the same, but we're dealing with different things. So often how to reduce and prevent risks are different when there's different causality. And this is not being discussed at all, hasn't been discussed in the childbirth movement, particularly the natural birth movement, which basically, and I know I'm going to sound like I am anti-natural birth movement, I'm not. It's just if you want more natural, safe births, if you want more normal, manageable births, if you want more physiological births that can be left alone, then you want a skilled birthing population that has spent time preparing their body for birth and pregnancy and has learned skills to cope and manage, handle, deal with, work through, stay on top of, and feel in control. Because the issues in childbirth aren't just whether you have no risks or risks. The bigger issue in childbirth was that women suffered, and that had nothing to do with risks. It had to do with the fact that the concept that we can become skilled to birth our baby has only existed within my lifetime, right? I just cannot tell you enough. The idea that we use skills in the 60s and the 70s, as inefficient as Lamaze and Bradley's skills were, they worked brilliantly to help many of us not suffer. And our husbands or partners could help us stay in control, even though we had no choices, no matter our risks. So you need to understand there's a gap in the childbirth conversation which is directly related to skills that you should have and are not being told to have. So you're looking elsewhere to try to solve problems. So we've gone over what predispose us, right? That's why flipping babies, spinning babies, external version doesn't work for so many people, because those predisposing factors are not being addressed at all. Can they be addressed? Well, septum can't be addressed. It is what it is, and having a breech baby is normal. A baby lying in a breech position is perfectly normal. It has some risks associated to it. It doesn't have the worst risks in the world associated. Babies that are head down can die, but dying isn't the only risk to mothers or babies, or the only tragedy. So we can't get into this either or. It's safe or it's dead. Right? Well, lots of things in between, right? But now we have to talk about how all of this leads us to these questions, right? And those questions are, what do we do about it? What are women nowadays that have a breech or transverse baby doing about it? And all you have to do is read the Facebook pages of what they're doing about it. We are, on the one hand, being told a breech birth or a breech baby is normal, natural, and physiological, or it's a variation on the norm. Everything's a variation on the norm. A norm is anything, right? It's natural, anything, right? There was a wonderful woman who was talking on TV the other day about the political unrest in the United States around Black Lives Matter. And she stood up and she said that her skin was her color. My skin's my color. And then she said, look at your hands. We all have the same hands. From our viewpoint as a trust called common knowledge, we all blink, we all cough, we all can tighten up our rectum. We are all individuals. However, whatever the higher power is that you have did not make one bird. It did not make one tree. It did not make one flower, she said. There are many different birds. There are many different trees. There are many different flowers. There are many different births. It's not a variation on the normal. Your breech baby, your septum, your weak uterine muscles, your weak abdominal muscles are normal. They're normal. So you have to then deal with this. And you're dealing within two concepts: a medical profession that believes you have risks, a natural birth movement that maybe believes you have risks, kind of, right? The modern medical system, they want to deal with the risks by doing assessments, monitoring, and procedures. The natural birth movement that may or may not be dealing with the risks are basically telling you to trust it. And now they're telling you to try to find a skilled breech practitioner. The skilled breech practitioners are having to deal with the fact that by and large, we as women with breech babies are not preparing our pregnant body to open up to let this baby out. And we're not learning skills to cope and manage better. So we are we're tasking them with a responsibility to save our baby if those risks unfold, as though they can do it, but we don't have either any responsibility or ability to reduce or prevent risks by what we do. And this is what I've spent 50 years trying to explain to people, because hundreds and hundreds of families said, please take this message forward. It is normal and natural to self-learn birth and birth coaching skills in pregnancy and use those skills when you birth your baby. So right now, what those of us carrying breech babies are trying to do now is to turn our babies. And we're doing that with skills, right? An external version is a skill that somebody else is doing, although many of us could do it on our own, right? So, and that's another conversation. Let us know if you want me to talk about these things. I can't do this in a void. The natural birth movement is telling you to basically stand on your head and try to spin your baby. But if you have a septum in your uterus, if you have a weak uterine tone and weak abdominal tone, some babies turn and most don't, and then most don't stay turned, and you don't know why. You just feel frustrated for having spent all this time doing that. And you haven't learned skills to cope with the fact that you may give birth to a breech or transverse baby. You're trying to take homeopathics. I'm very well versed in homeopathics and acupuncture and body skills to prepare for birth. I understand what you're doing because I've lived through this, right? So I can understand it, right? At the end of the day, this is just at the end of the day, bottom line, If you can turn your baby and your baby is head down and that birth proceeds fairly promptly and your baby comes out of your body without damaging your body and without having a problem for yourself, all of your effort has been worth it, right? And bottom line, at the end of the day, if you still have a breech baby, then you have to make choices whether you labor and have a vaginal birth, whether you labor and then have a cesarean, or whether you have a non-laboring cesarean, or whether you labor at home or whether you labor in the hospital. These are complicated choices. If you layer all of those with skills, then you realize that we think differently because we go, okay, it is what it is. This is my baby's birth, and I'm going to use skills to work through this activity of birthing my baby. And that includes driving to the hospital, being prepped, and having a very non-physiological experience of having a cesarean. At the same time, our body physiologically, normally and naturally, is still flooded with the hormones of pregnancy, still flooded with our capacity to work through this activity that takes time. That's what we want you to know. Birth takes time. We can fill it with our skills, or we become passive, and it happens to us. So what do we do about it? So right now, on all the Breech forums, you're all trying to turn your babies with success or not. And some of you are having cesareans, some of you aren't having successes, and many of you are really frustrated. And that's understandable because the gap in the childbirth conversation that began in the late 70s was the dismissal of skills. We need to get that back. If you let's see, how do I say it? If we use the Department of Transportation, all of us have to learn skills to drive vehicles. And the natural birth movement has said to me for years, but that's not physiological. You're right, it's not, but just bear with me for a minute. If none of us have the same skills to drive a car, there's chaos on the road. We all agree to learn the same skills. But more importantly, we agree to use those skills and adapt them and adjust them at every single nanosecond we're behind the wheel of the car. Because we know if we don't, we put ourselves, our children, our others at risk. Birth is an activity that requires skills that adjust and adapt and are sustainable through the activity. And we choose to use them, but we need to learn them first. And nobody is telling you. And so now I want to address the physiological aspect of this. There are two other physiological things: sex, being horny, and hunger, wanting to eat. So just let me address that, because this is what families taught me, and this is what I've come to understand. When we are horny, that does not mean we know how to be a good lover. Come on. We have to learn the skills to be a good lover. Yet, when we are having that experience, which takes time, we have to adapt and adjust sustainable, good lover skills to the experience. Now let's look at time. How long does it take to have really, really good sexual experience? I'm not going to answer that. How long does birth take? So birth is much more like driving on a long journey. Maybe it takes 3 hours. That's the short end of the stick. For most of us, 12 hours, 24, 36 and beyond. Come on, can we not even imagine in ourselves that if we use skills throughout that time and adjusted and adapted our skills, that we would have a better personal experience no matter what was happening to us around us or what sensations we were feeling? Yes, we can have a better experience, and all of us should be skilled to do that experience. Now let's look at hunger, okay? Hunger is complicated. We want to eat, right? But it depends on where we live, right? What foods are available? We are all one humanity. We've always been one humanity. Any man can impregnate any woman. Any child can get brought up in any culture, any religion, any language, any diet. And every culture knows what is safe to eat and not eat. I now live in X place. I used to live in X place. I've lived in 30 different places, which all have different foods and different poisonous foods. How many of you have children who are listening to this? How much time have you spent taking things out of your kids' mouths that are inappropriate to eat? So because we have an urge to eat, if that urge helped us to determine what was safe and what was poisonous, then that would be a good analogy, right, to childbirth, right? Because we just automatically know. But we don't know. We don't even know when we're eating foods we think are safe, sometimes when they've gone off and they make us sick, right? So we need to understand that until modern medicine came along, anything that happened in birth was normal, anything that could happen in birth was natural, and anything that did happen in birth was physiological. The good, the bad, the ugly, the happy, the sad, the miserable, the content, the pleasurable, everything was normal, natural, and physiological. Then the modern medical profession came along and said, we want to safeguard against risks because modern people demand that. We're glad we no longer live in villages where there's nothing we could do about it. Our perception is there's nothing we can do about it. So modern people glom on modern medicine to reduce or prevent risks. Then the natural birth movement came very strong in the 70s. And what the natural birth movement said, women have always given birth, we know how to do it, we just need to do it outside of medical care. But they twisted those words normal, natural, and physiological to imply that throughout time birth has been safe and easy, good outcomes, it's a nothing burger. That's what they've implied. And that's done all of us a disservice. And it's been done without intention. We understand, those of us who have been involved in birth for a very long time, and many of you listen to, you can just pop your kid out. You just think that everybody can do that. And women who just can't pop their kids out, they don't understand how you did it, right? So you have to understand that there are reasons why. And if we become more skilled, we understand those reasons why in ourselves. Same way. If you have a septum in your uterus, and you have weak uterine tone, and you have weak abdominal tone, that's different than a woman who just has weak uterine tone, but none of those two other factors. Or you have, in the same way with a breech baby, if you have a single footling or double footling breech, or you have a partial compound, or the arms are above the head, or where the placenta is, these are all factors. Some of the factors don't reveal themselves until the birth, right? So what can we do about it? And who are we? Well, we is everybody involved in the birth. And we're all trying to do our best. And we cannot always determine the outcome. The same way, you get in the car today, and you can get down to the first traffic light or stoplight on your street. You could have a heart attack. Your kid could swallow something and choke in the back. You could get broadsided by a truck. We do not know what the future is. However, when we apply skills in our lives, we then can respond more appropriately, right? If your kid chokes, learn the Heimlich maneuver, right? Oh, goodness, geez, I've talked longer than my 20 minutes. So then, beyond what do we do about it are all the decisions that you have to make. But really that leads us to the bigger question is, what do I do about it? And the I is the pregnant woman and her baby. And this is why we really, really, as a trust, okay, so there are people who have gone on to the Facebook Breech Births and said, you're only looking to make money for yourself. I have to tell you that in the 50 years that I have done this work with families, this has not been a compensation task. I have done it because families taught me the importance of becoming skilled, and they took time to develop the skills that are housed in Common Knowledge Trust. And they asked me to be dedicated to pass on the concept that it should just be normal and natural. We learn skills and then use the skills no matter how we birth our baby. And they tasked me to put together resources of the skills that they developed, and I have. But that doesn't mean that this video is a promotional video for our skills. It is a promotional video for the concept. It means you need to learn some skills when you're pregnant that you will commit to use to work through the activity of birthing your baby. We have a lot. I have over the years, I can't tell you how many tens and thousands of women said to me, I'm not going to do that. I'm busy. I have other kids. I have a job. I'm busy. And since the 80s, I've been doing all this research about my choices. I'm busy. I'm busy. I'm busy. I'm busy. Can't tell you how many birth professionals said, I can't possibly tell my families to become skilled. It's their choice. They should know. I can't tell you what this means to our societies. If you believe you are busy in pregnancy, are you going to have time for your baby once it's born? Of course you are. But here's the disconnect. Your baby's here now. You're pregnant with your baby, right? Really, you got to think about it. You're doing all these things to try to turn your baby. You're making choices because your baby's here now. So when all of these women over the years have said, I'm too busy to learn skills, we have a societal problem. Major problem. Major, major, major problem, right? And the problem is that we are not elevating this one-off, never to be repeated, this infrequent experience, even if we have 20 kids, this life-transforming, dynamic activity. We are not elevating it to where humans feel more empowered, which is skilled. We are more empowered when we are skilled. We all know that. And yet, we are not doing this. Partly we're not doing this because throughout time, there is still a truth. There's no way natural birth's going to be like, and babies don't come to plan. That's always true, yet birth unfolds. But it's also been true because the natural birth movement has told you that you don't need skills, that it's an insult to women, that we should just trust and use our instincts. And this has huge negative impacts in the 50 years that I've been involved in global childbirth. Huge negative impacts. Because my generation had imperfect skills and all of us felt more empowered by our birth within medical systems that gave us no choices and who fiddled with us from one moment to the next. So we used skills all through the fiddle. Right? So this concept is important. There are a lot of skills-based methods. What's important for you when you learn a skills-based method, particularly those that are focused on achieving natural births, keep using your skills even if things change. This is your baby's birth. You got pregnant to have a baby. Work through your baby's birth. It's an activity. It takes time. Every breath you take in, every breath you let out can have a skill attached to it. Every posture you have in your body, every position you take, your ability to relax, all has a part of it. Now, before I leave, I want to address the word fear in childbirth, because this is one of the things that the natural birth movement really has done a disservice about. We are hardwired, all of us, men and women alike, throughout every society in the world, to have fear around pregnancy, childbirth, and babies, because we know it sits on the cutting edge between life and death, and between pleasurable and suffering, and between healthy and trauma. So we're all hardwired for fear. And that's good. It's a gift. But we need to learn to use it. So how do we use it? And how do traditional people use fear as a gift? They recognize that when they're afraid of something, that they become more observant. You do too. You become hypervigilant. So what do you do with that hypervigilance, right? Because the fear is in the now, and the fear is for the future. So in the now, you have to ask yourself these questions. If I'm afraid of something right now, do I feel that my baby or I are within 5 minutes or 12 hours going to be dead or seriously injured. If that's true, if you feel the answer is yes, seek help or do something right away. Because that fear has made you vigilant enough to pay attention. If you aren't certain, then just become observant. And if you feel no, 5 minutes or 12 hours, and I don't feel that, I'm just fearful of the future, then stay observant. Because either something's going to worse and you'll seek help or do something, or it's going to not get worse and you're going to realize that this is a gift of fear. You're observing. You're just observing. Why is this important? Well, it's important in pregnancy because if you feel something isn't right, then do something about it or get help. It's important in birth because if you think something isn't right, get help or do something about it. But mostly it's important after your baby is born because your baby can't talk to you. All you are seeing or hearing what your baby is doing or sounds it's making. When you haven't grown that gift of fear, when you've tried to suppress that fear, then what happens after the baby is born is you just constantly are going, what's the matter? What's the matter? As though everything is potentially threatening. And that doesn't do us a service of being confident mothers or fathers. So we have to grow the gift of fear. So I've talked long enough. I just want you to know that your breech baby is absolutely normal. If you choose to have a breech delivery and you can find a skilled breech birth provider, that's wonderful. However, you need to prepare your body for birth. You need to learn the skills to cope with the natural occurring pain of labor. You do that for yourself. You do that for your baby to try to reduce or prevent issues. And you do that for that caring birth professional because you make their job easier when your birth moves along. It's as simple as that. So understand the concept. Be able to articulate these words to your friends and relatives and your birth professionals. It's normal and natural when I'm pregnant to self-learn birth and birth coaching skills and to use those skills through the activity of birthing my baby. No matter where I birth, no matter who's present at my birth, no matter my beliefs or my circumstances, no matter my choices or lack of choices or change of choices, and no matter what happens to me at my birth or around me. This is my baby's birth, and I am going to use skills to birth my baby. Talk to you some other time. Bye-bye.